Welcome back to the News Center on 10 ABC. I'm Christina Arangio. Well, seizures in pets, it's a tough subject to think about and deal with. But as a pet owner, knowing what to do in that situation is truly vital.
That's right. Let's check in now with News Center's Chief Meteorologist Steve Caparizzo, who covers the topic in this week's Pet Connection Extra. Steve.
Thank you, Christina and Steve. This is a very difficult one to do. I just want you to know that some of the video will be difficult to watch. Seizures in pets are more common than you think. Some can only last a few seconds to as long as several minutes. As a pet owner, you can sometimes tell when your pet may be acting a bit strange, and this could be the first signs of a seizure.
The most common form of seizures that dogs and cats will have are characterized, think of it as a grand mal seizure, where essentially they're completely lose consciousness. They can have spasms of their muscles. They can either be tonic and rigid, or they can have spasms. They lose bladder control. They can lose bowel control. And sometimes they'll be vocalizing.
There can be many different causes of seizures.
So if an individual starts to have seizures around the age of 1 to 4, it's actually usually classified as idiopathic epilepsy, which means that we're not really sure what the underlying cause is. But of course you want to rule out any other potential causes, such as a toxin or some sort of potentially trauma can cause it. Underlying metabolic diseases is another cause that can happen. Certain brain diseases, if it's happening in an older individual, we worry more about certain tumors.
There are 3 big things to look out for.
The first would be if the actual seizure is lasting for more than 5 minutes. The big risk there is that their body temperature actually starts to elevate quite a bit, and we need to intervene, stop the seizure, and get them under control. The second would be if they have what we call cluster seizures, where they have one seizure, they don't really come out of it, they're still in this semi-unconscious state, and they go right back into another seizure. And the last would be actually if they have more than 3 seizures in a 24-hour period. That clustering of seizures is almost a concern that it's going to turn into something more than that.
Thanks, Dr. Lexi. If your pet has 1 seizure, it probably isn't something to be too concerned about. For more frequent seizures and more dangerous ones, they can be treated with medications to help control them. If your pet has a seizure, consult with your veterinarian as soon as possible. Guys, back to you.
All right.